Hi, welcome. I'm John Allen, co-president of the New Haven Pride Center and host of Out in New Haven, where once a month we take a different topic of interest to the LGBTQ community in New Haven, Greater New Haven, and Connecticut and explore it. And today we're delighted to have representatives from APNH, formerly known as AIDS Project New Haven. Before we get into that, though, I did want to mention that the New Haven Pride Center is New Haven's first LGBTQ center and one of only two in Connecticut. And we serve Greater New Haven and the state in a centrally located office in downtown New Haven. Some of the things of interest are that the New Haven Pride Center hosts the largest LGBT award ceremony in the state, called the Dorothy Awards. And we also host the New Haven Pride Celebration in September. There's also the New Haven Centerline magazine, which offers news and interests and events going on around the center and in the state. So today we have representatives from APNH, which was formerly known as AIDS Project New Haven, and I'm delighted to be able to have Chris Cole, the Executive Director, and Fran McMullen, Program Director.
Mm-hmm. Yep.
Welcome.
Thank you. Thank you. Thank you for having us.
So it still rolls off my tongue as AIDS Project New Haven. That's going to be, I've known about this organization for so many years, and it's a long-standing, revered organization. Why the name change?
Well, we were AIDS Project New Haven for 35 years. And we were known as APNH to many because it was really easy. So in looking at what's happening around HIV and AIDS today, first of all, AIDS is not a relevant term anymore. We get people into treatment right away. Most folks are not ever presenting anywhere near an AIDS diagnosis. HIV is a much more relevant term. But we also looked at what are the programs and services and core competencies that we've developed over 35 years, and how can we deliver those programs and services to a broader community? And we're limited by our name. Mm-hmm. We were also limited by our name just as being New Haven, right? There are programs and services that we deliver outside of New Haven, and we have opportunities outside of New Haven. Right. So we started thinking, how do we re-identify ourselves? And it was important to me in thinking about that we maintain a sense of our identity. We have been around for 35 years.
Right.
APNH is the oldest AIDS service organization in the state of Connecticut.
That is incredible, and I think it's noteworthy.
And one of the first in the nation, really. You know, along with all the big cities, New Haven responded to AIDS 35 years ago, and it was a group of volunteers that came together, mostly healthcare workers at Yale New Haven Hospital, who said, we're watching these people die, and they're not dying with dignity, and there's fear and anxiety, and we need to step up and do something about this.
But also, I think it was a lot of community people, too, that were watching their friends and loved ones
absolutely, and they came together at Partners Cafe in a very informal setting and said, let's do something. Started a buddy program and started support for folks. And over the years, we've been able to apply for lots of federal and state funding and get grants and professionalize the services that we're able to offer. And we often get requests for our food program and our food pantry and even our case management, but certainly our behavioral health program. You know, folks who want counseling, and when they've come to us and we said, if you're not living with HIV, we can't provide those services for you. Right. And we've done that in a culturally competent way, certainly with confidentiality, but in a really loving, caring, understanding way that isn't always available out there in the healthcare community. So we started looking at, you know, it's time to change our identity, even in our testing. Our testing team would be out in the community, and we'd be doing STI testing and certainly HIV testing. We'd also be getting people in for a youth program, and a lot of people didn't want to go to AIDS Project New Haven. Right. So we started a couple of years ago saying APNH. And it's what many folks knew us as. Right. So I wanted to keep the APNH. So I have about an hour drive to work every day. So one day, I was playing with words, and the staff came up with lots of thoughts, and some were around APNH, some were not. And finally, I came up with Place to Nourish Your Health.
Right.
We're a healthcare organization. We want to become more of a healthcare organization. Right. Our vision is a culturally competent environment that's open and welcoming and affirming, where folks who face stigma in receiving culturally competent, high-quality health care can get that care. Where they can walk in the door and see someone who looks just like them.
Right.
Where they can come in and we're not going to ask their gender. We're going to ask them who they are.
Right.
We're not going to make any assumptions about their sexuality or their partners. We're a sex-positive, open environment.
Right.
So a place, we're a homey environment.
Right.
We're not a clinical setting, and that's always important, and that's one of the things that we will always be. We're in an old Victorian home. We're starting conversations about, we're growing out of that space, and it's an old space.
But you're still in the same location where you've been for a long time.
Where we've been for a long time. And it's important that people feel at home when they come into our environment and not clinic. So a place. We're a place. We're not a clinic. And to nourish your health, we have a food program. It's an important part of what we do. But all around, how do we nourish ourselves? Where do you feel nourished and nurtured? And that's what we want to be. And it's all about health.
Right.
Body, mind, and spirit. And it's about the whole person.
Right.
So that's the name change and the evolution of it. And the reason is because we want to serve a much broader demographic and part of our community, because we have the ability and the competency to do that.
Yes. So the new name is A Place to Nourish Your Health.
Yes, APNH, A Place to Nourish Your Health.
Right. And that's so true. Now, I've always known APNH really as a food service, or at least I've known about the food service for so many years. You've been well known for that.
Yeah.
And I wonder, it sounds like, is the behavioral health, is that a new concept with you?
We've been providing substance use treatment and mental health treatment for well over 12 years. We've been funded through Ryan White funding. We've expanded our services by billing Medicare and Medicaid, and we're working on building relationships with insurance companies and third-party billers so that we can bill and provide services for anyone who wants to walk in the door. So, we have a lot of folks in the gay community who want marriage and family counseling these days. That wasn't something that anybody thought about 30 years ago, because we weren't allowed to get married.
I know.
Who want to talk about the stigma that they may face, who certainly in the transgender community, anyone who's of the transgender identity and experience has some real, stigma that they're facing in their life, and we want to be able to offer services whether they're living with HIV or not. And we've begun to do that. So that's been a part of who we are for many years. It's not you hear about our food program because it's easy for us to talk about.
And it's fun to think about too.
And it's easy for us to raise money for. Everybody wants to feed people. Food is something we identify with. It's a social thing. But food, we identify with food. So when we're out in the community, we often talk about our food program. When we're raising money, we often talk about our food program. It's a lot more difficult to raise money to say, we would like for you to contribute $75, and that $75 is going to feed this many people, versus we'd like you to contribute $75 for a 1-hour behavioral health session for someone who's a drug addict. People don't want to support that,
I know, it's a tough sell. It is a tough sell.
But it's a huge part of what we do, and it's a huge part of what we need to be doing to get people to be well and to be whole human beings. And in our community, I'm a recovering drug addict myself. In our community, the stigma and the shame that we face from a very young age, growing up, especially if you're living with HIV on top of it, it's a huge and significant part of creating whole, well people, and then whole well communities.
Right.
And I think that's what our community needs to face.
Yes, I agree. Well, you know, Fran, one of the things that when I was doing some research about today's topic, just looking at the demographics of how many people worldwide are impacted, and I don't know what's going on in Connecticut per se, but I know worldwide, HIV and AIDS impacts more women and children than it does anyone else. And that's one of your focuses, right, is fundraising and...
Right. Well, I also work with HIV positive women. I run a HIV positive women support group that meets twice a month. So I'm really involved with the women in our community. I meet with them twice a month, and we have a group where I bring in speakers and educators, a topic of interest that the group has identified. We sit around, we have a meal, we have lunch, and we have a discussion. So I am more involved on that side, but in Connecticut, I don't know what the stats are as far as women.
Yeah, in Connecticut, it's more men than women.
Yeah.
Right now, where we're seeing new infections is young gay men.
Really?
Black and brown young gay men, and black and brown heterosexual women.
Don't you think that it's really because people aren't getting the message out there? We're not talking about, you know, having sex positive messages, or you know, are they not getting this, or is there still so much stigma attached to in the various you know, constituencies?
Yeah, it's shame and stigma. You know, we have Getting to Zero campaign nationally, and we just launched a Getting to Zero campaign, all the organizations in the state of Connecticut. And it's all about stigma and judgment. And if we can, it just came from the National HIV Prevention Conference last week. And if we can get people tested earlier, identify that they have HIV, and get them on highly active antiretroviral therapies, which are the medications that folks go on immediately now.
And one pill. A lot of times the regimen is one pill a day.
Oh my gosh, because I mean, you know, I just remember, you know, friends of
cocktails
mine taking the
yes.
cocktails, and how, you know, dangerous they were, and they just made people so sick.
Right. Well, we're not there now with medications.
And our goal is to get people to undetectable, meaning we can't find the virus in their blood.
Wow.
And if someone gets to undetectable, and we do a pretty good job here in Connecticut, the epidemic right now nationally is so centered in the South. And that's where you're seeing significant new infections, and we're doing a good job here in the North. But if we can get people tested sooner and on medications and to an undetectable level, which doesn't take very long and doesn't take very much, they just have to be adherent and on their medications, then they're undetectable. And if they're undetectable, they're not transmittable. U equals U is a campaign that's been launched on a national level.
U, and that means
undetectable is untransmittable.
Wonderful.
So if someone who is undetectable has unprotected sex with someone else, they won't transmit the virus. So that's a huge prevention method. So not only is allowing someone who's living with HIV to live a normal, healthy lifespan. Can you imagine 30 years ago if someone said that? We thought we had a death sentence if we had HIV. Now you can live a normal, healthy lifespan with HIV, and you can't pass it on to someone else. You're not cured. It's in your body, it's dormant, it's there, we don't have a cure.
There is currently no
but
cure.
But we can keep someone else from getting it. And if we can couple that with PrEP, pre-exposure prophylaxis, it's one pill that someone who is at high risk of HIV can take on a daily basis, they won't get HIV even if they have sex with someone who is detectable. If we can couple those two, we could reduce new infections to nothing. But we have to do both. And we have to get the information out there. And who's prescribing PrEP? It's our infectious diseases doctors. It's not our general practitioners. So we need to get them informed. And we're doing a good job here in Connecticut, especially in the gay community, of getting people informed. But the national average is that only 1 in every 10 people who would be a good candidate for PrEP are on it.
And we need to make the testing of HIV just part of your regular
Yes.
yearly physical.
Right. Now, the statistics that I saw was that in 2016, 36 million people in the world had HIV. In the United States, it was 1.2 million people.
And in Connecticut, it's 13,000.
Right.
And of those 13,000, a third live here in the New Haven area.
Wow. Big city. We have big city problems for being a tiny,
Tiny
you know,
city, big
a
city
tiny city. We
problem.
have some big city problems. Yes. I know. The thing that I think is important to just make the distinction is that HIV is the disease, and AIDS is
Well, HIV is the virus.
is the virus, and AIDS is the advanced form of HIV.
Right. AIDS is an advanced, it's when somebody has HIV for quite a while and then they'll start developing opportunistic infections and the CD4 cell count will go below 200. And again, there's no reason that should happen today.
Right.
We get people on medications immediately and we can turn that around like that. The only reason it happens today is because people take too long to get tested and diagnosed. And that's the shame and stigma. That's the, I don't want to know because I'll be judged. And we do have people today who will show up in the emergency room sick and get an AIDS diagnosis.
And yet your organization does the testing too.
Yes,
we do.
No cost.
I mean, because you
At
were
no
coming
cost.
to the community center periodically to do testing.
Right, so the state of Connecticut, through the federal government, through the Center for Disease Control, funds APNH to go out into the community and do testing with a very specific focus. So our focus is to find young gay men, in particular young black and brown gay men, because that's where we're seeing new infections, to get them tested and into care.
Right.
And we'll test anyone who walks in the door, but we're really funded just for that particular focus, because that's where we know their infections and that's where we know we have the relationships and the experience.
And when they come into care through your organization, what would be a typical sort of regimen?
If someone's newly diagnosed?
Yeah.
I mean, well, then we would immediately connect them with our, is she still called EIS?
Early intervention specialist, or one of our case managers.
One of our case managers. She would then connect them to physicians in the community, go to their first appointment with them if they choose. Some people are like, no, I can do it on my own, but some people like the support. She'll stay with them, go to every appointment, all their blood draws, make sure they see their doctor, make sure they stay in care.
Really
and make sure they
dedicated
understand
case
what's
management.
going on. This can be a confusing, overwhelming thing for folks.
Oh my gosh, I
And
can't imagine.
If you have someone who can help you and hold your hand and make sure you know what's going on and help you interpret your lab results and say, it's going to be okay.
Right.
You can live a normal, healthy life. You're going to be fine.
Mm-hmm.
And then we connect them to case management. And you're going to talk about how that works.
And every other service that we have. So our EIS, the first person that they would be connected with, would stay with them about 6 months.
Oh.
And as they transitioned away from her, they would be connected with our medical case managers, who would then continue as long as they felt they needed it. Life for some folks, and some people manage their own medications on their own. But it's making the appointment, making sure they get to their appointments, helping them overcome any barriers that are keeping them from taking their medication and staying in care.
Because, I mean, there's many celebrated cases now of people that have been living for a very long time. I mean, I was just, going through, looking on the internet, and there's, Magic Johnson had been living with HIV for so many years. Larry Kramer, one of the early supporters of our community center in New Haven, he's been living with HIV for over 30 years now.
Well, the women in my support group, the majority of them are 30-plus year survivors.
Right.
So, and John, the core of the services that we've been providing through our case management, which is really the backbone of what we do for someone who's living with HIV, is helping them navigate the system. And our clients are not folks who have health insurance, who have supportive families, who have stable living environments. We can handle our own health care for the most part. Our clients are folks who are living at or just above the poverty level. Who don't have stable housing, who are homeless, who have significant mental health or substance use issues, who need real support in just getting through those things. Because if you don't have a safe place to lay your head at night, or you don't know where your next meal is going to come
You
from,
don't have food.
you're not going to be worried about taking your medication.
Right.
And we want you to take your medication for yourself, but we also want you to take your medication because then you're non-transmittable. And as just a public health concern, we can reduce new infections to zero if we can keep people undetectable.
Right. I
So-
mean, you realize that so many of these things, it's not just one issue that might have caused this.
Right.
There's so many other,
there are a lot,
pieces to the puzzle.
And we have services for everyone. So, someone who's making $400,000 a year, I don't know who that is, but, and live in
Nobody
a
I know.
huge, beautiful house on the coast, can still come to our support groups, can still be a part of our community, can still get support with us. But the programs that we're funded to provide by the federal and state government are the programs for those who have significant barriers and have significant challenges.
Well, that is a real concern. I mean, so many people become, they're widowed or widowers, and they want to have relations. They're having unprotected sex. The next thing you know, they can be, and they can be sitting on a sizable portfolio.
Yeah. Well, and we have an exciting new program that we just started at the beginning of the year.
That's a good one.
Because a lot of us, well, we're all getting older, right? A lot of us are getting older with
I don't
HIV.
know. Right.
And again, in many cases, these folks never thought they'd get older.
Right. It's the first generation.
People who are living with HIV for 20 and 30, fortunately, I got HIV in a time when I knew I would live, and there were medications available. So, but as I get older, I have all the same issues as anybody else getting older, and so we have this new program it's called Aging Positively.
Wonderful.
And it's about pulling together a supportive community of people who will help each other live healthfully and decrease the sense of isolation and decrease depression that comes from that isolation and improve health outcomes. If you're a part of a strong, vibrant community, your health outcomes increase. You feel better about yourself, and you have all kinds of resources and support to help you do that. And that's what this program is based on. Anyone over 50 who's living with HIV, it's to pull them together and help them live their best life by being a part of a really vibrant, supportive community. And we're really excited about this program.
That's
And
brand
this
new.
is pulling people from all over the region and the state.
Absolutely.
Absolutely. Anyone. Yeah.
So what are some of the ways that you allow people to sort of get involved outside of being, do you look for volunteers, or is there...
All the time. Yep.
And so what are some things that people can do to get involved in APNH?
If they would like to volunteer with us, they would contact me, and I have a variety of tasks. Some could be a one-day, couple-hour task. Some could be ongoing, working with me every day to get our events going, help with the food program, or there's always something around the office that needs to be done. We staff our front reception area with volunteers, dedicated volunteers.
And I've noticed that your staffing has just, we were talking earlier, I've just, remember the organization being, a couple of volunteers and maybe a few part-time people, and now you just have really blossomed
17?
into it.
Did we
Yeah,
have
we're actually up
17?
to 20 full-time staff.
20 full-time staff, okay.
3 part-timers, and then we have contract professionals from from a psychiatrist to APRNs to LCSWs that provide our behavioral health program work as well. So, and we're growing. We're continually growing. We're growing out of our space.
Out of our space.
Really?
We're
I
growing.
know.
We take pride in our old Victorian home that was built in the
Yes,
1800s.
I know.
That's
Yes.
a homey, welcoming
Yeah,
environment.
so
but
people
we're
like
also
coming there
growing out
because
of
it feels like a home, and it is a home. But
I've been
you're
for
right.
meetings up in the attic space.
Oh,
and
yeah, the
how,
third floor, yeah.
Fun that was.
Yeah, we are cramped for office space, though, quite a bit, and always moving things around, too.
What are some of the events and activities that you do host now?
Well, the most current one is our Dining Out for Life program, which is coming up April 25th. But that's a fundraising
And that's
event.
an annual event.
That's an annual event, and it's always the last Thursday in April.
Yeah.
And people just go out to eat at a participating restaurant, and they're giving back to the community.
Right. So they
it's an
literally just
easy
have
one.
to go out and
Yeah.
eat, and they
yeah,
can
breakfast,
help
lunch,
out
or
your
dinner,
organization.
and we have anything from, you can get a bagel or you can go out to dinner and have a
And you have a
white
roster
tablecloth
of
dinner.
restaurants.
Yep, right on our.
and-
If you go to our website, you'll be able apnh.org, and that will bring you to the Dining Out for Life website. So it's like I said, you could get a bagel for $1, or you can have a dinner for $100. And either way, you're giving back to the community. So it's an
Right.
easy one to do. We have the Pride in the Park. Pride in the Park. That's
Well, we participate in that through other organizations to do outreach and such. We've done
We
an
have a-
annual fall event, which we're
we're moving away from
conceptualizing and moving
yes,
away
moving
from.
away from what we were doing
Yeah.
for the past 2012 was the first time we did
Yeah.
the Oktoberfest at the time it was called.
So that it's more healthy.
Yeah, so we're getting away from alcohol.
Right.
A big part of the programs and services
Yep.
that we provide are
Right.
behavioral health and substance use, and so we're getting away from alcohol. We're going to do an annual fall event that will really be just to invite people in and give them
Yeah.
updates
Come
on what
see
we're
who
doing.
we are. Come see what
Less
we're
of
doing.
a
Yeah.
fundraiser, but to keep people connected. And then
Right.
we're looking at, we did this this movie premiere
that's
event
right, yeah.
in
was that, November?
the fall,
Yeah.
which was around Bohemian Rhapsody.
Right.
Oh, how
And
wonderful! Yeah, with
fortunately-
Freddie Mercury.
Yeah,
he
right.
was a
And it was
person
really
that,
relevant.
yeah.
And,
Oh,
the
it's so
Connecticut Gay
amazing.
Men's Chorus came in,
And they
and they
sang,
sang
yeah, it was fun.
Queen
It was a lot of
songs,
fun.
and it was really a lot of fun, and it brought community together.
wonderful.
And so we're doing that again in May with Rocket Man. Where,
Elton
unfortunately, these great films
Yeah,
that make
great.
sense
Yes,
for our work
finally,
are
we're
coming
getting all
out.
these gay
Right.
films
And
that are coming
we're
out,
going to do
right.
another movie
Right.
premiere night,
How
and
wonderful.
the
Yeah,
chorus
it's
is going to come
opening
and sing
night
Elton
of-
John
Oh,
songs, and it's
great.
just. We're really looking at ways of how do we, in a healthy way, bring community together.
How great.
So
Yeah.
we're looking at adding something physical as well,
Yeah,
whether it's the walks and runs have been done for so long, but
Right.
we're trying to conceptualize something new that will also, so really focusing on the mind, body, spirit.
Right.
Right.
And
So what a new attitude, new
That's
name
right,
and a
new
new
name, new
attitude.
attitude,
So it's
right.
so wonderful. Well, we've come to the end of our
Already?
time, and
Oh,
I'm
that was
so
quick.
I know I'm so sorry. This has really been. I've learned so much today about the organization. Things that were what I had an impression from so many years ago, and how different the organization is now, and the service that you're providing. And I really appreciate everything that you're doing. Thank you for being here.
Well, thank you for having us. Appreciate it. You're welcome.
Well, I'm John Allen, host of Out in New Haven, and we've been speaking with Chris Cole, Executive Director, and Fran McMullen, Program Director of APNH, A Place to Nourish Your Health. Thank you very much.
thanks,
Thanks, John.
See you next time.